Hello and good morning, everyone. Mental health is something that affects us every single day of our lives. But what happens if you're a high school student who's getting bullied and you're not feeling safe at home? Or what if you are a college student just like us and you're living hundreds of miles away from family while you're trying to balance your schoolwork, so you have a job, and just life in general, all while feeling completely alone and you have no resources to help you? Many of us always talk about our grades and attendance and achievements in schools, but not nearly enough of people talk about how students are really doing in the inside. And that's what I want to talk about today, because the truth is our education system is not doing enough to take care of students' mental health. We must advocate for stronger mental health support systems within our schools, because every student deserves access to help, hope, and healing. So today I'm going to be going over 3 points. My first point is the percentage of help is too low in our education system. The second point is schools often lack the funding, resources, and trained staff needed to meet students' mental health needs. My third point is by advocating for expanded programs, more counselors, and more open discussion about mental health, we can create safer and healthier learning environments for all students. Let's start with the first problem. The percentage of students receiving help is way too low. Many students experience anxiety, depression, or stress, whether they're in elementary school, high school, or college. But for many of them, help simply isn't available. According to the National Center for Education Statistics, during the 2021 to 2022 school year, 49% of public schools reported providing diagnostic mental health assessments, and 38% reported providing treatment to students for mental health disorders. These percentages were lower than the percentages reported in 2019 to 2020. That means fewer than half of our schools even diagnose students, and barely 1/3 provide treatment. These numbers dropped significantly after the pandemic, even though that's exactly when students needed more help than ever. Think about it. Many kids lost parents or grandparents due to COVID-19. Families face financial stress, isolation, and grief, and yet access to help went down during these times. For a lot of families, therapy is expensive and out of reach. That's why school-based counseling is so important. It may be the only help some students can ever have. But the sad truth is, even schools that want to help often can't afford it. Schools want to do better. Teachers and principals care deeply about their students, but when there's not enough staff or money, mental health gets pushed aside for some reason. This brings me to my second point. Schools often lack the funding, resources, and trained staff needed to meet students' mental health needs. The biggest issue schools face is insufficient funding. Without it, they can't hire trained counselors, social workers, or psychologists. According to the NCES, the most commonly identified barriers to providing effective mental health services include insufficient mental health professional staff coverage to manage caseload, which is 55%, inadequate funding, 54%, and inadequate access to licensed mental health professionals, 49%. Imagine being one counselor responsible for hundreds, sometimes even over thousands of students. This problem isn't new though. Even before the pandemic, the education system in America struggled to balance budgets while meeting students' needs. But now that mental health has become such a visible issue, the lack of progress is unacceptable. As Peggy G. Carr, the commissioner of the NCES, stated, "We've always known that the responsibility of the schools go beyond academics, but these new data shine important light on the demands they face to support students who struggle with mental health issues. These challenges can be significant obstacles to students' learning and well-being if not properly addressed." Now, if students are struggling mentally, it's hard for them to focus, stay motivated, and even come to school. Their emotional states directly impacts their ability to learn and what they show in the classroom. So what can we do about this? This brings me to my third and final point, advocating for change. By advocating for expanded programs, hiring more counselors, and encouraging open discussion about mental health, we as a community and as a country can create safer and healthier learning environments for all students around the nation. Many students feel pressured to be perfect, to get straight A's, join clubs, work harder, and make their families proud. But when they compare themselves to others and start to feel like they're not good enough, it can lead to burnout and depression. I've felt that way before personally. I was overwhelmed and I felt like I wasn't inadequate enough with compared to my peers. And I know I'm not alone. That's why it is crucial for schools to not only care about grades, but also students' emotional well-being. As stated by the Office of the Surgeon General, expanding programs that promotes healthy development such as social and emotional learning and providing a continuum of supports to meet the social, emotional, behavioral, and mental health needs of children and youth. Now, programs like this can teach coping skills, emotional intelligence, and resilience, tools that can last a lifetime. And to make them effective, we need more professionals who can deliver that support. The Surgeon General's office also recommends expand the school's based mental health workforce. This includes hiring and training additional staff, such as school counselors, social workers, and school psychologists. Governments should invest in building a pipeline of school counselors, nurses, social workers, and school psychologists. If we increase investment in this area, even a small fraction more, schools could fill these roles and make mental health more readily available for students. I want you to imagine a school where everyone feels seen, heard, and supported, where instead of being judged for struggling, students are encouraged to talk about what's going on, where counselors have to really listen, and where students aren't afraid to ask for help. That's the kind of future we can help create if we continue to advocate for change in mental health resources for schools. So, to review, point 1, the percentage of students receiving mental health support is far too low. Point 2, schools lack the funding, resources, and trained staff to meet the growing needs. Point 3, and by advocating for expanded programs, more counselors, and open discussion about mental health, we can build safer, healthier schools for everyone. I hope that after hearing this, I've inspired you to think differently about mental health in schools. All of us, students, teachers, and parents, deserve access to support systems that help us not just survive, but thrive. Mental health isn't a weakness. It's part of being a human. It's part of who we are. And when schools prioritize mental wellness, they're not just improving education, but they're saving lives. Thank you for listening, and please keep the conversation going.